So we set out to see Dr. Davis to seek more knowledge about sickle cell anemia. Dr. Davis is a consultant hematologist and blood transfusion specialist. She is a consultant hematologist and blood transfusion specialist at the Ifako General Hospital. So basically, she treats people with sickle cell anemia or anybody that has issues relating to blood, because she's an hematologist.
My name is Dr. Davis. I'm a consultant hematologist and a blood transfusion specialist. I treat patients with sickle cell, and as a form of recap, sickle cell is an inherited disorder where patients will inherit the sickle cell gene from both the mother and the father. They could present with sickle cell crisis, such could be hemolytic phenotype where they require blood transfusion more, or they are the non-hemolytic phenotype where they present with vaso-occlusive crisis, especially with pain and or stroke. As a way of treatment, patients with sickle cell should endeavor to take their folic acid regularly, their BICO to increase their blood production, and to also take their paludrin to prevent severe form of sickle cell. And then fourthly, they should take a lot of water, minimum of 3 liters of water every day, and then they can achieve their full potential. Thank you.
90% of the world's sickle cell disease population lives in Nigeria, India, and the Republic of Congo, where it affects up to 2% of the population. Evidence suggests Nigeria has the largest population of persons affected with sickle cell disease globally. Borno and Yobe states has the largest number of sickle cell traits in Nigeria, with prevalence of 27.9% and 32.6% respectively. Why is this? Could this be due to ignorance, illiteracy, or unawareness?
Welcome to Lakeside TV. So I'm here with Dr. Davis. She's a consultant hematologist and blood transfusion specialist. Good morning, ma'am.
Good morning.
Thank you for honoring our invitation, ma'am.
You're welcome.
Yes, ma'am. So basically, we're just here to seek more of your knowledge about sickle cell anemia, ma'am. So, ma'am, please, can you tell us what is sickle cell anemia?
Okay, thank you very much for the question. So, sickle cell, it's an inherited disorder where an individual inherits the hemoglobin S gene from the mother and also the father. So when you have 2 hemoglobin S inherited from both the mother and father, then the individual would have what we call sickle cell anemia.
A child gets sickle cell disease when he or she receives 2 sickle cell genes, one from each parent. A child who inherits one sickle cell gene has sickle cell traits if both parents have either SCD or SCT. It is important for them to discuss this information with each other and with the doctor when making decisions about family planning.
There's some causes like maybe cold or like dehydration. So like those stuff causes crisis also.
Yes. So what happened is for sickle cell there are different presentations that they have. For some, when there is stress or dehydration, that means there is not enough water in the system. These blood vessels, collapses. So it makes it easier for this red cell to stick to the surfaces of these red cells, and then the spiral effect of just cells piling up, and then they block the blood vessel.
And like the same applies to cold also.
Cold, dehydration, even though the presentations are different in the sense that there are 2 clinical presentations. So we have what we call the hemolytic phenotype and the non-hemolytic phenotypes. So what that means is that for some patients, they tend to lyse, their blood vessels, their blood tends to break down faster than the other, where some, or most times, their bloods, just block those blood vessels. So for those that have hemolytic phenotypes, that means the rate at which their red cells break is faster. Those will present with more complications requiring blood transfusion more often than the other. Where those with the non-hemolytic phenotype, their blood cells don't break down as much. However, they tend to stick to the walls of the blood vessels and then cause complications of pain, what we call vaso-occlusive crisis.
There are 4 types of sickle cell crisis. We have the vaso-occlusive crisis, aplastic crisis, splenic sequestration crisis, and the acute chest syndrome. Things like physical or psychological stress, cold weather, alcohol, tobacco products, lots of fluid, infection, and many more triggers sickle cell crisis. The most common is the vaso-occlusive crisis. Vaso-occlusive crisis has sudden onset, usually lasts 5 to 6 days, and may be localized in one area of the body or generalized. Pain can occur in any parts of the body, but commonly occurs in the hands, feet, chest, and back. Pain that comes suddenly and lasts for a short time is referred to as acute pain. Chronic pain is a daily ongoing pain lasting more than 6 months. People with sickle cell anemia can experience acute pain, chronic pain, or both.
Cure for sickle cell anemia?
Yes and no. With the advent of technology and innovation, there is a lot of treatments going on what we call in treatment and final treatment of patients with sickle cell disorder. So those patients that don't have as much complications as the other can actually go through what we call bone marrow transplants. And what that means is that the patient with sickle cell would get a new set of red cells being transplanted into their system, and they now start producing what we call sickle-free red cells, and they don't have those complications. However, there are also studies about gene therapy, whereas they go directly into the gene sequencing of the sickle cell and prevent patient from having sickle cell disorder.
But like this will cost way much.
And with government intervention, I'm sure there will be, yes, it is expensive, yes, but that is why one of the major cost of treatment is to prevent patients with sickle cell traits from getting married. But there are, with funds, I'm sure with the health insurance schemes and all, the government can, infuse funds, and the patient with sickle cell can have cure.
Can sickle cell anemia be cured? Well, it depends. A bone marrow transplant seems to be the only way out. A bone marrow transplant, which involves collecting healthy cells from a donor's bone marrow and transferring them into a patient, can cure sickle cell anemia. However, a bone marrow transplant may not be the best choice for all patients because it comes with a serious risk. A bone marrow transplant expert can advise patients about whether or not it is a good choice for them.
Now, what is the best compatible genotype to get married?
So the best there's nothing like best compatible. It is just we should endeavor to have individual with hemoglobin S traits, not to get married. However, it is worthy of note to say that for a patient with hemoglobin AS, yes, when they get married, the chances of having sickle cell is just in probabilities. So the probability of having an SS child for an individual with sickle cell trait is sickle cell anemia is 25% for each pregnancy. So you can have 4 children and have all SS. You can have 4 children and none are SS. You can have 4 children and all are AA. So it is per each pregnancy the probability. So we usually don't want to have that probability, tested, and then you have an SS child. So we try to say when you are AA, you can marry AS, you can marry SS, you can marry CC, hemoglobin C. So the AA genotype can,
marry
anyone. Yes.
Yes, genotype.
We usually discourage
compatible.
Yes.
Why ASSS is not compatible? Because
ASSS is not compatible. The probability is even higher, of having the children with SS, like up to 75%. So it is even higher for AS to marry ASS children.
What of the AS and CC?
It is that will take us to what we call hemoglobinopathies. So it's a broad term. What hemoglobinopathy does is there's a disruption in the hemoglobin pattern. So there are different types. S is one, there is C is one, is also an hemoglobinopathy. So we usually discourage because there are all forms of hemoglobinopathies and they present alike. So you wouldn't, except your doctor distinguishes them.
Let's not be guided by our emotions and always think about the future when choosing life partners. Why I'm saying this is that many people are always lost in love and thereby fall victims of getting married to someone with sickle cell traits or a sickle cell carrier. That is, someone with genotype AS marries someone with genotype AS, or someone with genotype AS marries someone with genotype SS. Who suffers this? It's the unborn kid, making them go through pains and struggles in life. Sickle cell anemia is bad, so therefore let us prevent it.
There's a popular mentality that people have about those that have sickle cell, like they tend to have a short lifespan, and they don't live for that long. Why?
That ideology has been far, gone. There's so many research that have gone through. Sickle cell patients live to their full potentials once they stick to their health regulations and lead to their health regulations and treatment. They tend to live fine. So that myth is, far gone with the advent of new technology in the treatment of patients with sickle cell.
Because most people still carry that mentality.
No. There's so a lot of treatment that has, come about, and patients with sickle cell tend to live their. I think the oldest patient with sickle cell is still for now about 67 years.
That's the oldest so far.
No, we've had people with 80 something. So the myth has been, far dissolved. There's people live their full potentials and they are doing great.
Late Ashanta Onikoyi Laguda happened to be the oldest sickle cell patient in Nigeria and sub-Saharan Africa. She died at the age of 95 years, where it was said she lived a healthy and well-fulfilled life. A person with sickle cell anemia can live a healthy and high-quality life.
What's your tips or your health advice for people with sickle cell anemia?
So my health tip for patients with sickle cell anemia is to know your genotype, which is one step to cure to treatment. Then you want to take your folic acid regularly, because the sickle cell does this to increase the rate at which red cells die. So you want to take folic acid, which will help in blood production. You also want to take your vitamin B co, which would help in the formation of red cells. You want to take your paludrin, which would help in the treatment of preventing severe forms of malaria. And the fourth one is to take your water, which will help in the dilution and then hydration of your blood vessels, and then increase blood flow to every part of the body.
motivate, and support my fellow warriors out there on the sickle cell journey. Hi, I'm Lakeside, not a regular guy.